Hi everyone, I'm Dr. G. Welcome back to Face It with Dr. G. So excited to be back. We are just on a roll with podcasts. We missed last week, but we're still on a roll. And Rachel's laughing at me. So we've done so great having all of our incredible guests on here. It's been a whirlwind. It's been so fascinating, so enjoyable for me and hopefully for the guests and hopefully for you guys to learn more about these guests and who they are and what they do and the intricacies of them and their role in aesthetics, and I just loved it. So thank you for all the awesome feedback. I love to hear from you guys, and today you've got only me. Hope you're excited. And I wanted to dive into just a concept, a question, an idea, no, really just an issue. And I find this issue to be surrounding the aesthetic, quote unquote, the industry. And I don't like using the word industry when it comes to talking about aesthetic medicine, because we're not an industry, we're aesthetic medicine, and we're medical providers. We're physicians, PAs, NPs, RNs, DOs, DDS. But the industry part of it, the side of it, is the pharmaceutical side of it. So where we get primarily our injectable products. And I have to preface this and just rewind a little bit. I haven't practiced what I'm going to say here. I promised this would be completely unfiltered, but I don't want to offend anyone. I want to be informative and not offensive, but I do want to be real. So where's that line? And I'll try to do my best here, but I don't want to be offensive. I know some people don't really care, but I do. I'm not here to hurt anyone's feelings. But I wanted to talk to you about my history and the progression of relationships that I've had with the different pharmaceutical companies. And when I opened in 2017, I was new to aesthetics. I had experience in my dermatopathology fellowship because I was in a dermatology department, and that doesn't happen for all dermatopathology fellows, but I was very lucky, blessed, whatever word you want to say, fortunate. And I had injectable guidance and experience from dermatology residents and dermatologists and Mohs surgeons, all of them. When I opened GFace MD on the side of my primary practice of dermatopathology, I didn't really know who to go to. And that's one of the reasons I've told you in the past, if you listen to other episodes, I didn't have a mentor. And so I really had to learn, teach, grow myself, and lean into colleagues and friends that I developed along the way. And when I opened, I was indebted to one specific rep. And she really helped me. She guided me, she helped train me on basics, and at that time I wasn't aware of the inherent bias here. I just wanted to learn. And I think that's important here. You have to understand where you are and what you're getting from a relationship, because I needed that. That's where I was going to grow. I needed that guidance. And yes, it was on a certain type of product, and right now I'm just going to keep that out of it. But she was really there for me. She helped me, she guided me, she hooked me up with other people to help train me. One of those, I'll give a shout out to Michelle Doran from RN Aesthetics. She's fantastic. She's up in Salem, Massachusetts, and also in Newburyport, has a phenomenal practice, and she was one of the first injectors to come in and train me hands-on, and this was really fantastic. And I know a lot of mentors and trainers don't get credit for what they've done, so I just want to make sure to point those people out. So she was instrumental, and my rep at the time was the one who made that introduction, so I was really thankful. And then as that relationship grew and changed, I realized that, as I evolved as a practitioner and injector, that pharmaceutical relationship changed. And it changed because I believed they didn't have my best interest in mind. And this was just a feeling, maybe I was also experiencing difficulty with those products, which I was. I didn't love them. I liked my results, but I was like, there's more out there. I wanted to experience more. So that relationship faded a little bit, and what I want to caution you all is that everyone wants to win here. Pharmaceutical companies want to win, the reps want to win, hopefully we want them to win also, but there has to be a mutual respect. And when you feel that respect isn't there anymore, for example, they're just there to get you to buy a certain amount of product, to close a certain number of rings, or to get to a certain tier, or get them to their president's level, of course, if you have a relationship with someone and you're like, I want you to win, you have helped me so much, and I'm going to put this huge order in so you can go on this trip. Of course, that is a personal and business decision that you have to make. And I think that's my overarching theme here, is that you're a business owner and you have to make those decisions for yourself and what's right for you, but you want to help them. So then as I grew and I started experimenting with other products, once you start developing a portfolio in your practice as a business owner, you decrease the reward for your business because you're spreading everything out across multiple companies. And there's different families of belief here. What's the word for that? Different belief structures. Rachel, I can't remember what the word is. Thoughts, different thoughts. Schools of thought, that's the word. Different schools of thought here. So yes, having a wide variety of products you can offer allows you to be super, super customized with what you offer your patients. Awesome. But no, you have to understand the science and that you're not selling a brand name. You have to understand what your hyaluronic acid filler is made of. And I'm specifically talking about hyaluronic acid fillers here because hyaluronic acid is a molecule. It's a structure. It's a polysaccharide. It is hyaluronic acid, period. Okay? It's hydrophilic. It absorbs water. And yes, we alter this hyaluronic acid molecule when it's extracted from wherever it's extracted from, right? We alter it to do certain things. However, we can't associate the brand name with the result. And I think that's what I realized maybe 4 years ago, 5 years ago. The pharmaceutical companies are genius. They brand things like Restylane Kiss. Well, all you can think about is that this goes in the lips. And Restylane Eyelight. Well, that's only going to go under the eyes. Restylane Refine and Define, those are obviously a little bit different. Restylane Contour. So these names are made for a purpose and for advertising. I get it. It's called marketing. However, Restylane Kiss is still a hyaluronic acid with a certain type of property. It doesn't just have to go in the lip. And so I think when we're learning and growing, I don't fault anybody for this, but you have to start somewhere and you start learning in a very fundamental way that's associating with names. So you have to get outside of that. And once you do that, you'll realize that you don't need 20 different fillers on your shelf. At least that's what I realized. I'm going to start working with all these different companies and I'm going to see how all these different reps treat me, and your relationship with each of them is going to be very different. And certain ones have really cultivated a relationship with me. And that's fantastic. You buy more of their product. It's a great relationship. But what happens when you stop? So I got to a point where I didn't need 20 different fillers on my shelf, and I wasn't gaining the rewards of any of them because I was spread too thin. So then what happens? You really see people's true colors when you start decreasing your ordering. Okay, so I've decreased some of the ordering of some of my products, and I'm really honing in on and narrowing my selection, mostly because my team has been so amazing at talking about their results about patients and how much they love certain fillers, and they've been open to trying anything, but now they're like, no, I like this product the best, and I like this product the best, and you naturally just choose the ones that you like the best. So now that I've started decreasing my ordering with certain companies, I find that the relationship has again changed. Why aren't you ordering? We're going to decrease your privileges with the company because of your decreased ordering, so on and so forth. Well, first of all, I don't care. I'm not here to make your pharmaceutical company more successful. I'm here for a partnership, and I'm here to grow together. And I'm not here for you to hold things over my head that you think that I hold so much weight and put so much weight on speaking for your company or whatnot. I don't care. But at a point I did. And at a point I thought it was important and I wanted to do that. I wanted to gain exposure, et cetera, et cetera. But once I realized my purpose and that my purpose is to grow my companies, to create amazing results and have partnerships where people truly believed in me versus not really believing in me, I realized everything changed. But I do believe you have to go through the whole process. You have to start somewhere. You have to learn about products. You have to trust your reps, and they are amazing and they do a great job, but they're not injectors. So you also have to understand they know the science, but they don't treat patients. And they also aren't there to see patients for follow-up. So what do those patients look like a year down the road, 10 years down the road? How does that filler settle? What's the end game here? What product do I end up dissolving more of? All of these things I take into consideration when I realize what I actually want to offer from my practice. So then going from one product to learning to then a huge portfolio of products to feeling overwhelmed with cost. Results were awesome, but not any better than they were in the past, actually. More confusion with my team about actually what product to use because there were too many options. Then honing in on one or two companies that we really believe after all of these years have given us the best results, and then seeing how those relationships have changed. And my question to you is, where do you stand with the pharmaceutical companies? What is your relationship with your reps? How do you feel? And trust me, I love our reps. I think they're fantastic. I love them just as humans. I think they're wonderful people. But at the end of the day, they're there to sell you their product. And it's their job. So where do you stand? Do you feel overwhelmed with what do I order? And I get this question a lot in my mentorship of where do I start? This is the cost of the product and I can't afford it, and et cetera, et cetera. And then how do you tailor your decision on what to ultimately offer? You can always expand your portfolio again. But I do find that it takes experience, it takes a team to understand what these products offer, and then a team to help guide you as a leader, if you are the leader, on what they like and what they don't like. And that's how you decide. I believe that the patients who ask what products they're getting want to be informed. I don't blame them. They'll research about all the different injectables, but at the end of the day, my words to them are, trust me with this. Sometimes I say truly and blatantly, do you really care? And they'll be like, oh. And I'll say, do you really care what I use? Don't you trust me enough to be sitting in my chair for my expertise to guide your treatment, the product choice, the immediate result, and the long-term result? And they say, yes, I do. That's why I'm here. So we don't offer vending machine medicine at FACEit, and you shouldn't either. It's very different for a patient to come in understanding that they want a certain treatment and leaving with the best result that was actually achieved a different way. And that's when you become a provider, you become the medical provider you are, and you're determining the result. So I would be so curious to hear all of your experience with your reps, where you stand right now. I think that we are in a period of inflation right now, and everyone is feeling it. Food is the most expensive it's ever been, or recently. Products are really, really expensive, and this year and the past year, I think, have been really hard for medical aesthetic practices to survive. Not only just to survive, but obviously to scale and grow to get bigger. So how do you manage that? Well, maybe consider scaling back a little. Don't offer as many products. Figuring out which one works for you. Opening up your eyes to other companies that maybe want to have a relationship with you that will help you achieve that. Maybe you have an academy and they're like, oh, we'll give you all this product for an academy. Or maybe they'll, gift you product. Whatever it may be a little bit more receptive. I think that's been something that I've been open to at GFaceMD to help manage these times, because not only do we feel it as a business, but the patients feel it, obviously. They're managing their expenses differently. The holidays are coming up. I'm very curious to see how the holiday season is going to go with spending habits. And we like to be very aware of these. So I hope this was helpful. I hope it will help you exhale a little bit and feel as though you can regain your power when it comes to product ordering and product choice. If you are a business owner, and I am primarily speaking to you, this is a business that you are running. Your business has to exist for you to take care of patients and to create beauty. And those results are paramount. But if you don't exist, you can't do that. So I encourage you to look and take a deep dive into your financials, I guess. Look at the products, look at the cost, look at how you're structuring your treatments. A lot of the time, actually, all of the time, actually, the skin health treatments actually bring in more revenue for the practice than injectables. And it's because the product costs so much money and it's only going up. We can't just keep raising the prices for these patients, even though we have VIP and we have, cherry financing and all of this, whatever we can do to make it affordable. So encourage a relationship with your pharmaceutical reps and your companies, but keep in mind that you are not there for them. You are not there working for them. You are working for you. And once you realize that, doesn't mean you can't have an amazing relationship, but you take control over your thoughts and your business. I hope this was super helpful. I've been talking about this for a while, but I didn't know how to actually relay the message without it sounding negative. And there's nothing negative about it. I just want you to understand the phases of rep relationships and my personal experience. So I hope this was helpful. Enjoy. Give me your thoughts. Share this on social media, and I'll see you guys next time.